I asked a bunch of doctors, what is the worst thing that they heard another doctor say? I'll go first. When I was a third-year medical student and I was on my surgical rotation, I watched a surgeon make a mistake in the midst of a procedure and then say, not that big of a deal, the patient is a UPS worker, might as well get disability. I thought that was a heartless, cruel statement, and it was clear that this doctor was incredibly disconnected from the empathetic side of healthcare.
My name is Dr. Anthony Yoon, and I'm a board-certified plastic surgeon, I'm a YouTuber, and a podcaster. I was in my training and I was working with another plastic surgeon, and we were performing liposuction on an African-American woman who was HIV positive. Now, we had gotten about an hour or two into the operation, and we really didn't create a whole lot of a change with her when all of a sudden he said, "That's it, we're done." And I looked at him and I looked at the patient. I said, we could do a bit more to get her a better result. And he said, you know what? I gave her a discount and she's got HIV anyway, so let's just quit.
Hi, I'm Dr. Siobhan Deschauer, although online you may know me as Violin MD. I'm a rheumatologist, so I specialize in joints and autoimmune diseases. Back when I was a resident, I was studying for my licensing exam, and one of my supervisors walked by and, with a completely straight face, said, "Don't worry about studying so much. That's why we have malpractice insurance." And at the time, I just laughed it off. But after spending a couple of weeks working in his clinic, I couldn't help but wonder, maybe he wasn't joking.
Hi, I'm Dr. Rocio Salas Whalen, and I'm an endocrinologist and obesity board-certified physician. The worst thing that I've heard another doctor say, and this was to a patient in the labor and delivery room, a woman who was in labor, and this female doctor was doing a pelvic exam, a digital exam, to see how much she was dilated. The patient was screaming out of pain, and this doctor told the patient, "Well, I'm sure when your husband was sticking it up inside of you, you were not complaining of pain, right? So suck it up." Awful.
Hi, my name is Dr. Alok Patel. I'm a pediatric hospitalist. If a child is hospitalized, my people are on it. I once took care of a patient whose family only wanted to be seen by white healthcare professionals. The father straight up said, "We do not want to see any Black, Hispanic, Asian, or Indian doctors or nurses." It became a thing, it was handled, but in the break room, I overheard one doctor defend the family. This doctor was like, "Hey, if they want to only see white people, let them only see white people." Kind of went down in the break room. There was some drama because that's not right.
What's up, guys? I'm Dr. Antonio Webb, a board-certified orthopedic spine surgeon, also called the back doctor. One of the worst things I've ever heard a doctor say to a patient is, "This is my first time doing this procedure. Wish me luck."
Oh, hell no!
Hello, my name is Austin Chang, and I'm an interventional gastroenterologist. One of the worst things I've heard other doctors say is that other health professionals like nurses, medical assistants, technicians, etc. are somehow less important than doctors, and that couldn't be further from the truth. We literally could not do our jobs as doctors without the help of everyone else, and it takes everyone coming together to take care of the patients. I can't tolerate that because that sort of disrespect is what's contributing to a lot of burnout and why people are leaving the field. We just need to respect each other more and value what everyone brings to the table to get this to work.
Hi, I'm Dr. Dana, and I'm a podiatrist, which is a foot and ankle specialist and surgeon. Occasionally, I've heard doctors speak negatively about their patient while they're in the operating room asleep, and I just think this is wildly inappropriate. The patient's in a vulnerable position, and it's just not okay to talk this way. It's certainly something that I never tolerate in my operating room.
My name is Jake Goodman, and I'm in my last year of psychiatry residency. The worst thing I've ever heard a doctor say about a patient was, "It's all in his head, it's not real." In our head is a really complex thing called a brain. It's an organ just like any other organ in your body, and it can get sick, just like your other organs. So like if your pancreas gets sick, you can get pancreatitis. If your lungs get sick, you can get emphysema. If your brain gets sick, you can get depression or anxiety, PTSD, psychosis, insomnia. It's in our heads, but that doesn't make it not real. It's as real as any other medical condition.
Hi, I'm Dr. Rina Malik, urologist and pelvic surgeon. And a urologist is a medical and surgical doctor of the genitourinary tract. And we urologists take care of a lot of things. That includes cancer, sexual health for both men and women, bladder health, and so much more. The worst thing I've heard people say has come from trainees, and they've said that they don't want to go into a specialty like mine that takes care of annoying women. Now, this is a real problem because there's a ton of bias against women in medicine, even as patients. And because of it, women have worse outcomes and get listened to less often, and it's time to change that.
Hi, I'm Dr. Brian Boxer-Wackler. I'm an ophthalmologist, AKA eye surgeon. There was an ophthalmologist who made a comment about patients years ago that had a procedure called RK, or radial keratotomy, which causes the cornea oftentimes to become unstable and need subsequent procedures over the years. And he said, RK is just the gift that keeps on giving. And I just found that really repulsive and really offensive.
Hi, I'm Dr. Jack Turbin, and I'm a child and adolescent psychiatrist who takes care of transgender youth. And I'm author of the new book, Free to Be, Understanding Kids and Gender Identity. The worst thing I've heard another doctor say is that they wouldn't acknowledge a young person's gender identity until their depression was cured because they thought their trans identity was from depression. There's no evidence that depression makes someone transgender, and also in psychiatry, it's really important to understand the whole person. And often someone's depression is because they're being mistreated because of their gender identity.
Hey, I'm Dr. Dhaval Banasali, a board-certified dermatologist here in New York City. The meanest thing another doctor said to me in medical school, I had a doctor ask me, after I told him I wanted to be a dermatologist, they asked why I didn't want to become a real doctor. I guess we'll never know.
I'm Dr. Gary Linkov. I'm an ENT specialist with subspecializations in facial plastics and hair restoration surgery. One of my biggest pet peeves is doctors adding procedures to their practice just to make more money. They might not care at all about the actual procedure, but they're just doing it for the bucks. And that, I think, is the worst way to practice. I think that everyone should be striving to do the best possible work that they can and elevating their game constantly and doing things because they're passionate and because they're looking to deliver the highest level of expertise possible.
Hello, my name is Mauricio, but everybody calls me Dr. Mau. I'm triple board certified in internal, emergency, and obesity medicine. I assisted a female specialist in the hospital when I was a resident. She needed to talk to a Spanish-speaking patient, and I offer translation services, basically. And they discussed many things, including past romantic relationships. And I was there in the middle of the conversation, translating, hearing everything about the love life of the doctor and the patient. And it was truly, truly weird.
TMI, my friends.
My name is Ricky Brown, and I am a board-certified plastic and reconstructive surgeon. I was in my clinic seeing a patient, and I have a health and wellness aspect to my practice where I always preach health and wellness first. Lifestyle change, weight loss, meal plans, that's what I preach first. Surgery should be your last resort in plastic surgery. So I see a man in my clinic who's got the classic very round belly, a lot of visceral bulging in his belly. So I walk in to interview this guy because his consult was for liposuction. I asked the guy, I understand why you're here. We had a conversation about why liposuction wasn't proper for him, that a meal plan change and lifestyle changes were going to be the way for him to go first. But I asked him, I said, why, who referred you and why? And his answer was, my internal medicine doctor referred me and she told me to come get lipo because I could afford it. Really? And I was not happy about it. And needless to say, I told him, you need a new internal medicine doctor as of today.
Hi, I'm Dr. Glaucom Flecken. I am actually a board-certified ophthalmologist. The worst thing another doctor has said is, why don't you look that up and present it tomorrow during rounds? It was an attending who said it to me.
Hey, newbie. Watch out for the bedpan.
Hey everyone, my name is Dr. Sanjay Juneja and I'm a hematologist and medical oncologist, otherwise known as a blood and cancer specialist. The worst thing I ever heard another doctor say was basically when I was empathizing with a situation that was pretty stressful for one of our medical assistants. The advice I received was, Sanjay, you can't show care or get concerned about how someone may feel about a circumstance in your clinic, because if you give an inch, they'll take a mile and they'll just take until you can't make anyone happy. So try and remove yourself from hearing those things and not make yourself vulnerable, which I think is completely incorrect and wrong, and that a strong team gives strong care, and that it's, you know, really the most important thing when delivering, especially cancer care in a stressful clinic.
Do you get hiccups? I know I do. Do you know why they happen? Click here to check it out and how to stop them. As always, stay happy and healthy.